Hi everyone, Dr. Sheila Farahani at Harmony Dental Wellness. I'm live here on Facebook to talk with you about toothbrushes. How do you pick a good toothbrush? How do you know which one you should use? I want to, number one, show you the hand brushes. So this is what most people have in their bathrooms, and what I want you to know about hand brushes is as long as you are using a soft, extra soft, or gentle, you're doing fine. Of course, if you have a medium or a hard brush, please throw it in the garbage or write on it that says dirty and then use it to scrub your grout. Something like that, because those should not go in your mouth. Your gum tissue is so soft, it's so delicate. If you use a medium or a hard brush, likely you're damaging your gums. You may cause recession from using that. So your standard soft brush is going to look like this. It may have different types of little rubber tips or lots of different lengths of bristles. You may find all sorts of strange differences up here. None of them are all that important, honestly. A soft brush is a soft brush. What feels good in your mouth is really what matters on that. Now, I carry the Gum brand brushes in my office because this thumb pad holds your thumb, holds the brush at a 45-degree angle for you, so that if you're on the top or the bottom, you're already oriented properly to the gum line. So if I've got my thumb on that pad, my bristles are going exactly as they should down towards the gums for optimum cleaning of that area. If I'm on the top teeth, same thing. It just automatically puts it there. I don't have to think about it. So I really like this brush. The next one I want to show you is this one. This is also a gum brush, but this one has these feathery little bristles. This is a gentle brush. It's an extra soft brush. It's meant for people that have recession, people that have extra sensitive teeth, anyone who needs a little extra care. If you've ever had a deep cleaning, this is probably the brush you should be using. And what I want you to notice is that those bristles being feathered are going to be very gentle. They're also going to be very good at getting in around the roots of the teeth, down under the gums a little bit better. So if you are looking for a hand brush, those are the ones I would recommend. Now, we can talk about electric brushes, and the question is, how do we know which electric brush we want to use? So I have two main candidates. They are Sonicare and Oral-B. I think this one is called the Triumph, and sometimes it's also known as the Genius toothbrush. And I believe the current Sonicare is the Diamond brush. They're both very good. The science behind them shows that they're both very effective. So how do you know which one you should get? Here's the main differences between them. Number one, this one of course has a diamond-shaped head, and this one has a round-shaped head. Why is that important? It's important mostly when you're getting in two places, up around the very back of the top teeth and the tongue side of the very bottom teeth. And depending on how wide your tongue is or the shape of this bone, you may find one feels more comfortable than the other. I find that this one is a little bit better at adapting around those back teeth, and that's where most people have trouble getting their teeth clean. You've got a big saliva duct right there on your cheek, so people get a lot of mineral built up on that back tooth, and this brush can kind of wrap around that back tooth a little bit better than the Sonicare. And so that's why number one, vote for this one, the Oral-B. So difference number two is the sound of it. Okay, both of these have almost identical frequencies, but they sound very different. I'll hold them way up close to the phone. Hopefully you can hear them. First is the Oral-B. Sort of a throaty, deep sound. You'll notice the brush head here has this sort of motion. It also technically has a little bit of a pulsing motion, so it adapts really well around those teeth. Some people say this feels too vigorous. Some people say it's a little too aggressive. For them, I like this one. Listen to this one. So gentle, so quiet. A lot of people like this. What I will say is that people that have sensitive teeth often think that this kind of tickles. So if you're one of those people that think that an electric toothbrush is going to tickle, then maybe stay away from this one. So that's a personal preference. I don't have a vote in either direction on this. The last thing I want to point out about electric brushes is this little ring light. I want you to see what happens if you try and brush too hard. You see that light change colors and turn red? It tells you if you're pushing too hard. And so for people who are scrubbers instead of brushers, that's going to be really helpful. Sonicare has the same thing on their newer brushes, but the light's all the way down here. So when I'm brushing my teeth, I can't even really see that spot. So for me, again, it's a vote for this one, for the Oral-B. Those are the two major Sonic brands. There's a few others out there. Things like the Quip, which to my understanding have not been approved by the ADA. They technically have a sonic frequency, but I can't rule one way or another on how effective they are. Time will tell on those. If I was going to spend money on an electric brush, I would invest on the one that research has backed, and that would be one of these two. So I hope that helps answer any questions you have about which toothbrush you should pick. If you have questions, go ahead and send them to me. I will be happy to answer. I hope that you are staying safe and well out there, and I will look forward to seeing you soon at Harmony Dental Wellness. Thank you. Bye.